I remember it was a Saturday morning, and I was reading an article about the number of cases, the number of individuals with HIV and AIDS in the state of Florida, and I was completely astonished to read that Florida was ranked number 3 in the U.S. with respect to HIV/AIDS cases. Our company is about providing healthcare services, but I thought, what if we could actually provide a health plan specifically tailored for individuals with HIV or AIDS.
A former colleague of mine contacted me and gave me some information about Simply Healthcare and a specialty plan that they were looking into starting. As I looked into the plan, it looked like an ideal model for the treatment of people with HIV infection. And I really wanted to be a part of that. I knew and I do believe that this is sort of the future of how HIV care will be delivered for many people who are infected.
I think that the plan such as Clear Health Alliance, working with the University of Miami, is important and will be a model as one moves forward for how healthcare is given to at least the HIV population.
I think a community such as Miami has a lot of fragmented services where people get certain things, certain places, and they have to be moving around the health system, and it gets confusing for the patient. And sometimes because of that, they drop out of care, particularly if you belong to a minority. So I think having a comprehensive plan that put everything together, it will make it easier for them to stay in care and get the benefits of HIV treatments.
The patients that we serve, Medicaid recipients with HIV disease, they don't always know how to navigate the healthcare system. And so Clear Health Alliance is a plan that brings that expertise to the patient. Every day, and I mean every day, we work with physicians and nurses and pharmacists and anybody who's involved in providing care to people living with HIV disease. And we want this plan, and this plan is a plan that delivers that expertise. We have a motto here at Clear Health Alliance, and it's never lose a member because we couldn't meet their needs. And every day we work towards that goal.
People all around the world know that regardless of the background, socioeconomic status, age, that 20 years ago opened up himself to the world and let the world know that he had HIV. That's Magic Johnson.
Because of the HIV virus that I have attained, I will have to retire from the Lakers. Well, I think when I announced 20 years ago my new HIV status, I think I started to understand that I wanted to be a better husband, a better father. And then I wanted to help people around the world. And then also try to stop the discrimination against people who have HIV or AIDS. And so those things are really important. Well, I think 20 years ago when I announced, the public really started going out getting tested. They took HIV and AIDS more, I think, seriously, and really started to educate themselves about it. But I would say for the first 10 years that happened. Now for the last 10 years, we haven't seen that. I think that, they see me doing well, so they think that, well, if Magic is doing well, and if I get HIV, I can do well too. And that's not the case because the virus acts different in all of us. But the great thing about what has happened is that when I announced 20 years ago, it was only one drug, ACT, and now there's over 30 drugs. The treatment is so much better now. How am I going to be here a long time? And he said, you got to take your meds, you got to have a positive attitude, and you got to work out like you've always done your whole life. I said, that's all I have to do to be here a long time. He said, yeah. I said, okay, well, I'm going to be here a long time.
He became very, very excited about it when he heard that there was a health plan out there that had been designed specifically for individuals with HIV, AIDS, and that had the professionals that understood this. Magic basically became part of Clear. He became the voice of Clear. He became someone that could send our message out there, and he became part of our team. And we're very, very fortunate to have Magic Johnson on board here at Clear Health Alliance.
We all have a lot to live for, and we must figure out what that is, what's important for you. I want to grow old with my wife. You know, that's important to me. I want to walk my daughter down the aisle one day when she wants to get married. That's important to me. I want to see my 2 little men become men. That's what's important to me. So I make sure I take my meds based on I want to be here.